This is very short video on hearing testing. There are so many video on hearing test, that is Rinne test and Weber test, and among those video my video is very short, and hope this short video will be helpful before your exam. Just so hearing test thing done by two tests, Rinne and Weber. Rinne and Weber test. Rinne test done on the side of your head. On the side of your head, and Weber test done placing the tuning fork on your head, on the head. This is the first thing to remember, because sometimes we get confused on our exam. So Rinne test done by placing your tuning fork on the side of the head, and Weber test done by placing the tuning fork on the head, that is about the vertex. Okay, so this is the first thing to remember. Now again, Rinne test. By Rinne test we want to see whether the air conduction versus bony conduction. We want to see the relation of air conduction with the bony conduction. Normally air conduction is more than bony conduction normally, and the Weber test, by placing the tuning fork over the vertex, we want to see whether there is any lateralization or no lateralization. Normally there is no lateralization, as that means the patient will hear the sound equally on both sides. So this is the normal finding, mind it. I repeat again, normal finding is on the Rinne test AC more than BC, and on the Weber test no lateralization. So next in case of conductive, there is two type of deafness: conductive deafness and sensory neural deafness. So in case of conductive deafness, Rinne test and Weber test. In case of conductive deafness, Rinne test, BC will be more than AC. Normally AC more than BC. In case of conductive deafness, Rinne test will give BC more than AC, and Weber test will be lateralized, of course, lateralized to which side? To the affected side. If the problem conductive deafness is on the left side, Weber will be lateralized on the left side. That means the patient will hear the sound on the left side more than the right when Weber test is to be done. Okay, so this is conductive deafness. Now sensory neural deafness. In case of sensory neural deafness, what is about Rinne test? Rinne test will be AC more than BC, just like normal. Normally AC more than BC. In case of sensory neural deafness, of course AC will be more than BC, mind it. And what about the Weber? The Weber will be lateralized on the good ear, on the normal side. So lateralized to the normal or good side. That means if the sensorineural deafness on the right side, Weber will be lateralized to the left side. I repeat again, conductive versus sensorineural deafness. In case of conductive deafness, Weber will be lateralized to the affected side. If the problem on the left side, Weber will be lateralized to the left side. In case of sensorineural deafness, Weber will be lateralized to the normal or good side. For example, if the problem in the right side, Weber will be lateralized to the left side. So this is in short about normal, conductive and sensorineural deafness. So for the recapitulation of this topic, we can tabulate the information. Normal, this is the normal. Rinne test normally AC more than BC. In case of conductive deafness, BC more than AC, just opposite of normal. And in case of sensorineural deafness, Rinne will be just like normal, that is AC more than BC. So AC more than BC, this finding is found in case of normal or in case of sensorineural deafness. And in case of conductive deafness, this will be reversed, that is BC will be more than AC. Now the Weber, in case of normal, it will not be lateralized, that means it will be in the midline. So it will be midline, that is the patient will hear the sound equally on both sides. And in case of conductive deafness, it is lateralized to the affected side. Okay. And in case of sensorineural deafness, it is lateralized to the not affected side or on the good side. Okay. Not affected side means normal or good side. So this is all about. Thank you very much. If anyone else have any question, comment, query, any criticism, please put your valuable comment on the comment box. Thank you very much.